to stream, add to stream, add to stream. Boom. Topaz,
The picture's not there.
Okay. How do we?
Topaz, we're now live, guys. We got Dance Vera, Monica Paula Cotivo, the one and only Monica Paula Cotivo. Ivan Lamoureux, and Topaz Clinical Research. We need to get the camera on, guys. I don't know what's going on, but device is not connected. You'll get there. You'll get there. I think I can hear you. And can post comments to some destinations. So we're going to wait for people. We're going to do Q&A with anyone out there. We're here to answer your questions about clinical research. We are also here, okay, if you're watching this on Facebook, LinkedIn, or YouTube, put in the comments where you're watching from right now. Also, where in the world you're watching from. And Monica and I are going to talk to you guys about, well, we've had a lot of interesting things happening with CRC Academy, Monica, students getting hired. We need like the students on this channel. We should actually invite them. I think it supports one more person, but right now, you know, maybe it's too soon, but we've got a lot of good stuff happening with Latinos in clinical research. We've got a lot of good stuff happening. Keep the likes going, guys. And by the way, if you're on YouTube and you're watching this, let me pull up my phone. I got to do this every time for the algorithms, all right? But while I'm looking, why don't you talk about the CRC Academy and like the good news we've had from the students? Rich from New Jersey, how's it going? London, UK, in the building. What are you guys doing right now? What are you drinking? Let me know what you're drinking. Monica's going to talk about CRC Academy.
So, what do you mean, like?
You said a bunch of students get hired, right?
Okay,
Oh, we got
yeah.
Dublin too. Dublin, I hope you're drinking a Guinness. Drink one for me. Drink one for me.
And for me.
And for Monica. Okay.
So, yeah, we got many students getting hired. Very exciting. We got students getting hired in Mount Sinai, in some clinics around United States. Like, I mean, and the students are also thinking on opening their own business. So, I mean, this is great. I'm very excited for the students that the new careers, and also for the ones that are thinking on opening their own business. Is just mind blowing, because the industry right now is booming. We all know that.
Amar.
Plus, we need
Amar
more.
from Dublin, Rich from New Jersey, Yusuf from London, UK. Where does a PMT clinical research? Guys, we're here to motivate you, inspire you, answer your questions. But first of all, we gotta fix this, okay? I don't know if anybody can see this. Look at from YouTube. Do you see what's wrong with these numbers? Okay, 75% of you watching this video are not subscribed. Not subscribed. I thought it was the other way around when I first saw this. Why I only started commenting on it this year. Somebody told me, no, Dan, 3 out of 4 are not subscribed. I was like, whoa, let me look at this again. You're right. This is what's going on. YouTube, subscribe and like, please. So Monica, yeah, students have been getting hired.
Yeah.
Internationally. Internationally.
Yeah. Now that you say international, we have students from UK, from Australia. I think that's it for now. Yeah.
And then you guys, we got 2 guests on. We just came over. Watch the cross promotion here. It gets like the combo gets wicked. We just came over from Patreon. Patreon.com/DanceFera. Monthly mastermind. When we get 50 people in there, we're gonna go 2 masterminds. Guys, the best $5 a month you're ever gonna spend in your life. Or at least that's my goal. I was taught today by Marjorie that the energy that I put out is going to pay me back dividends. So I'm putting out energy, the best $5 you're ever going to spend. It's my job. It's my job to make sure that that's the case. It's my job. But let's go live on Instagram too. Marjorie, Topaz Clinical Research, you guys introduce yourself really quick. And then we're going to go through the comments. And Ivan is a marketing genius. So we're going to answer people's questions and put your questions in there. Wilmington, North Carolina, how's it going? We just had someone in the Patreon channel from North Carolina. All right, let's go.
Hi, I'm Marjorie.
and with Topaz Clinical Research. Sorry, I'm choking here. Marjorie with Topaz Clinical Research, and this is Carla.
Carla Francisco with Topaz Clinical Research.
And we are in Apopka, Florida, and we were excited to be in this industry, and that's what we were talking about previously in the Patreon. And make sure that you do join Dan's page here and subscribe, because I've been subscribed to him since 2016, and there is so much that you can learn about this industry. We were talking about the growth in the industry and how much more the industry needs to grow. So definitely be subscribed if you are interested in learning as much as you can and having personal growth. This is the page. This is the guide to listen to.
Join the Patreon.
Join Patreon. Join YouTube. And that way you get to hang out with us.
Thank you, guys. Very nice of you. They were not paid to come on and say this.
I expect my check next week. Thank you.
Yeah. So, best comment during this live stream wins this book. And if you have it already, I have other books you can take your choice. Or if you don't and you want another book, let me know and I'll send you that one.
I won that book in the past. I won the book with the best comment. So
See,
I won it in the past.
actually won. You guys think that there's some people who think that all these contests that we're not actually giving away.
No, it's real.
It is real.
Yeah,
I don't know how to go live on this. Let's go live, Monica. Yeah, except for the CRA Academy. Look, guys, I'm disappointed. The January CRA Academy, I wanted to give away a spot. Nobody followed the directions all the way. And like Marjorie taught me, you got to be very passionate and demonstrate your energy and your love for clinical research. So nobody won. First time, it's very sad. First time in 2 years, nobody won.
Yeah. It's just a grant sitting there, just waiting for somebody to take it. Just all you had to do was follow directions. And I was disappointed when you posted that. I was like, I can't believe it. That was a perfect opportunity that was missed out.
For the free CRA Academy class.
Yeah. Nobody won it?
Nobody did everything they're supposed to do.
It's because I think people sometimes they oversee the messages or they have interest on something, but they don't have the passion. What we were talking about.
Exactly.
They
Everything
don't have
is
the
related.
true passion. They're not determined to achieve the goals they want. Imagine having the opportunity to do it for free and you're not doing it.
Yeah. I couldn't believe it when you posted that.
Or even if you don't want to do it, you can give it to someone who might be interested.
Exactly.
Yeah, I said they can do that too. We got, when will it be posted again? In April. Baltimore, Maryland in the house. South Korea in the house. I love South Korea. Okay, so what were the questions? I don't even remember. Or the instructions. I made it harder. This is why nobody won this time. I made it harder. You had to get on a webinar.
Yeah.
In order to do that, you have to be on the email list. So a lot of people failed right there. Actually, a lot of people failed because they're not subscribed on YouTube. So go subscribe. But then the webinar, at the end of the webinar, I didn't say it on the webinar. If you registered for the webinar, I sent the replay. And in the paragraph with the replay, I put the instructions. And I also texted it to, and here's what you got to do. You got to text the word guru to, they just changed the phone number. You got to text the word guru to 855-942-5288. I also sent the instructions that way. So made it a little bit harder. I didn't just send an email blast this time. But you know what? We got April. And then we got CRC Academy always doing giveaways too. So wanted to introduce you guys to Topaz Clinical Research and Ivan. And you all know Monica as well. Topaz is going to be hosting the March Latinos in Clinical Research Zoom meeting. And then Ivan, feel free to introduce yourself as well. You know, like let's everybody do a quick little 2-minute introduction of themselves on this live stream, and then I'll look at the questions here.
So my name's Ivan Lamrou. Crankworks is my company. We do digital advertising. We do online development. We've been specializing in the research trial area for about 3 years now. What we're finding is that there's a gap in the market in terms of filling the funnel when it comes to getting registrants. And what we're up to is trying to broaden our understanding of the market, but also lend our ability and our knowledge around branding and communications to the industry.
Awesome.
Thank you very much. And a Patreon member. Thank you very much, Ivan. And Topaz, you guys, I mean, the whole industry needs to know who you are. You guys need to connect with Marjorie and Carla right now, and Ivan and Monica and myself. Believe it or not, there's people on this LinkedIn that are not connected to any 5 of us here. Okay? So you guys need to connect. Stop being strangers. Actually, before we get into Topaz, let's go through this question because it's going to get lost in the mix. There's a question here I want somebody to
Up.
yeah, because
right
I'm going to
here.
lose it. Where does a PMP fit in with clinical research positions? So PMP, that's project manager of some sort? What's PMP? Can you put in the comments? I think they asked it.
That's Richard D. Bartolo.
I think it's project management. And then somebody asked you a question, Ivan. Registrants, do you mean getting advertisement for enrolling participants?
No, I'm more in line with getting people to trial sites is what I was referring to. So once the research trial has begun, or has been discussed, we would get people to the site.
Okay. And we got clarification, PMP, project management professional. I'm going to give that to Marjorie because she, from the 5 of us here, actually worked for CROs and sponsors. So where did the project managers fit into all this? Like somebody's out there, no experience in research, but as a project manager, what can they do? What should they do? What would Marjorie do if you were that?
What would Marjorie do? That's a great career to get into, project management. I mean, but get into the industry, I think you would need to start maybe with the feasibility groups, looking into feasibility groups, just running projects within the organization, within the pharmaceutical company. You would have to build up experience to actually be a project manager in a project like a clinical research study itself. That's something that but the way to probably get into the door is to start looking at those other departments. Start looking at the CTA group, start looking at feasibility, start looking at there's so many different opportunities in pharma, not just necessarily saying I'm going to be a project manager for this clinical study. You'll get there, but get your foot in the door. I think you need to start looking at those different departments just to get your foot in the door. Unfortunately, this is a business that we all want to get into. The first thing they ask you for is, do you have experience? Well, no, I don't have experience. So then how do I get into the door? I mean, this is the thing. So look for the opportunities. As a project manager, there are such great opportunities within them, within the CROs, within the pharmaceutical companies. Look at the smaller pharmaceutical companies. Don't look at, don't start out looking at the big Pfizer and the Roche. I mean, if they're not even giving you a chance to get in the door, look at those small therapy, the new companies, brand new companies out there. I mean, there's you can go on Google and just start listing like, okay, what pharma is out there, and start looking at that, because unfortunately, there is a lot of work out there. There's a lot of opportunities out there, and that are just not being filled. So there is work in the industry. It's just, how do you get in there? And how do you get in there is by saying, I'm willing to do what it takes, whatever the company needs for me to do. So not necessarily I'm going to come in and run this entire project, but how can I work with this team so that eventually I will run that project? That's just my opinion. That's just what I've seen that works in the industry. I had friends that had project manager degrees, and they started with feasibility groups. They started with the CTA groups. They started in the mailroom just to get into the pharmaceutical company. Once you're in there, the potential for growth is immense.
And Aubrey from Raleigh, North Carolina. I'm working on my PMP, project management professional. Richard says, thank you. I have 6 months with Quintiles. I mean, they're called IQVIA now, but yeah, quintiles is old school for us old
Oh,
school
yeah,
people.
yeah.
Would data management and auditing be considered transferable skills for entry level CRC? I'll let the CRC Academy instructor herself take this one. Would data management and auditing be considered transferable skills for entry level CRC?
Yeah, she's saying, what would management data and auditing consider transferable skills for entry level
Hello,
CRC?
Mari.
I mean, I can actually share a link with all the description what it takes to be a clinical research coordinator. It's and to answer the question, I will say yes, because I mean, pretty much every skill that you have or every experience that you have in the past, all the skills are transferable to any industry, and why not to the most elite industry, that pharmaceutical research, right?
So here's my answer. Would data management and auditing be considered transferable skills for entry-level CRCs? The answer is, my answer to all these questions that when people ask these kind of questions is why not? Why not? You just heard from Marjorie. By the way, they own a site, okay? So they know what they're talking about. They're not just talking hypothetically. They actually hire clinical research coordinators, Topaz Clinical Research, all right? Of course, your skills are transferable. Are you kidding me? Data management, auditing, this is what research like consists of.
Yeah.
Okay, so you got to have more confidence in your transferable skills. You've got to have energy. I need to see the energy right now. And I need to see energy in these questions. I need more questions because this book needs to be given away. But why don't you guys talk about it, Marjorie, or anyone from Topaz, about this person's question, okay?
I think with data management skills and auditing skills, I mean, that's an amazing opportunity to look to become a CRA. I mean, those are transferable skills. I mean, trust me, there's so many CRAs that wish that they can get into the QC department. Look into the QC, see what's happening. I mean, all pharmaceuticals have companies have to have a QC department, not only within just the data, but looking at just managing a team, managing the labs, managing the vendors. I mean, you have to have auditing, you have to have QC, and everything has to do with data. I mean, everything that's happening in pharma is data. But yes, you have that is an amazing transferable skill. But it's like, okay, what's your confidence level, right? What are you going to bring to the team? What are you going to bring to the company? This is where you need to be passionate about what you're talking about. Because yeah, I have data management experience, I have auditing experience. Yes, but that can be transferable. And I can tell you a quick story. I was a study coordinator once, and I didn't want to be a study coordinator anymore. And I decided I was going to change my career. And I went to it was a job fair on a Saturday. And when I arrived, and I think I might have told you the story in the past, Dan, I showed up, I had my two-piece suit, I had a lot of confidence. I showed up with my CV, and it was actually a job fair where they were looking for analytical chemists. Everybody there had a doctor's degree. I had my little bachelor's degree. I showed up there, and they did like a whole presentation, and I tried to sneak out the door. I was like, I'm in the wrong group. So as I was sneaking out the door, the VP of the company came up to me and he said, you know, I see you smiling. I see you're excited about what we presented. Who are you? So I said, you know, I think I'm in the wrong meeting. I think I came to the wrong job fair. You know, my experience is in clinical research. I was a study coordinator. I don't know. I know you guys are looking for analytical chemists, but I don't think that this is what, you know, is going to work. And he said, you know, let's go talk to our QA department. So I went and interviewed with the QA manager. And then after I interviewed with the QA manager, I interviewed with the owner of the company. He said to me, I don't know where we're going to put you. We're going to give you a job here. So, wow. I mean, it was like, he said, I told him, I said, look, I said, QC, QA, whatever. I know what it is to pay attention to details. I know what a protocol is. I know what a SOP is. I know how to follow directions. I mean, I know what I need to do here. He said, we're going to offer you a job. He offered me the job that Monday morning. That was on a Saturday. Monday morning, I got a letter from them, FedEx. They offered me a job. At the same time, that next day, I was interviewing to become a CRA. So I said, do I go work for this company or do I become a CRA? And I went on the CRA route. I'm glad now that I went in that direction. But the fact is that I was in a job fair that had nothing to do with my skills. But because I was confident in what I can offer the company and what I can do for them, I mean, the worst they could have said was like, we love meeting you today. We can't offer you a job. And that would have been fine. I was about to sneak out the door. I left there with a job. I mean, so really, if you want to get into the industry, it's like, what can I do? What's my confidence level? How can I get into this industry? I don't care if I have to be in the mailroom. This is what I'm talking about. It's about getting your foot in the door. And it's the same thing if you look for a job at the pharma company or if you come to a research site. I don't want anyone who is low energy at my site. I need people who are passionate what they're doing. We have a person that just started with us, and we were talking about this earlier. Has no experience in clinical research, but her excitement about learning and about knowing about clinical research and what she used to do in the past, I was like, yeah, let's bring her on.
It can transfer.
It can transfer.
I'm so glad, Marjorie, you guys are on, because it feels refreshing to hear someone else give the exact same answers as I would give. But now you guys see, it's not just me thinking these things, okay? No. Look, here's another one I get a lot, and this is the kind of questions that we need to, they're limiting. So, and it's not really a question, it's a statement from somebody who's like extremely intelligent and is very qualified to work in this industry. Many companies ask for more than 5 years of experience. They can ask for whatever they want. I could ask for like 1 billion Bitcoin right now. Actually, I don't think I could get 1 billion. There's only 21 million. I can ask for anything I want. Not going to get it. These companies, sure, they can get 5 years, somebody with experience. What are you going to do about supply and demand? You can't be picky when supply and demand is in the favor right now. In 2021, I almost said 2022 and skipped this year. 2021, what are you going to do when supply is in the favor of the employees? It's on your side, people. Who cares what they ask for? Let them ask for that until everybody that they should have hired gets hired by somebody else.
I heard this at the where I used to work. It was brought up because we were hiring. And that was always kind of the mindset, right? Like of how many years has someone worked somewhere? It always looks good. They've been at the same job for 10 years. And we actually started, we would say this is a different generation. 2 years. People work 2 years. That's it. They work 2 years in a place.
And we covered kind of this in the other mastermind group as well, where personality goes a long way.
Yes. Absolutely.
It's like you're not just hiring on qualifications.
Exactly.
Let's face it, there's going to be a lineup of people who've gone to university and college with their accreditation.
Say that, Monica. Please tell them. Say it for the people in the back, Monica.
Soft skills.
Soft skills, exactly. You're right, Ivan. It's more. I mean, what can you offer the company? What's your confidence? And like Dan was saying, right now is the moment. I mean, with 2020, everything kind of slowed down. Everybody was focused on getting the one vaccine out. I mean, everything. And meanwhile, there were so many jobs that were sitting there. I mean, I talked to a pharma, actually a CRO, a few months ago. And they had 200 job openings for CRAs.
Yeah,
I was in shock. And what was so interesting about it, I came in there with 16 years of experience, and they were like, "What? You have 16 years of experience? We're lucky to get anybody with 2 years, but we're And I thought,
you know what those things are? You know what I figured out that those job requirements are? They're filters. What they're really trying to say is, don't even dare apply if you don't know what you're talking about.
Exactly.
It doesn't matter the years. They just put that as a filter. If they put 5 years and you only have 4 and that turns you off, then they know, okay, this person's not confident to do this job. Look, somebody on Instagram just said, absolutely. I got a CRC role for a job that asked for 3 years experience in research, and I just applied. It's my first job in research.
Awesome. Yeah.
Amazing.
Do it. Just apply.
Just apply. What's the worst they can say is no.
It's a numbers game. Keep applying.
Well, people are afraid of rejection. This is a limiting thing. It's a mental block. You need to join the Patreon channel. We'll get that out of you.
Yeah. I mean, it's just a little tiny word, right? And that's it. No. And then you move on. Nobody cares, right? I mean, just move on. But I do have to say, just get those 2 years of experience. I mean, when I started out as a CRA, I worked for a company that was running me wild. I was flying all over the US. I was so tired. They were doing 80 hours a week. And I just kept thinking, I have to do 2 years. I get those 2 years experience under your belt, and the world is yours, right? Oyster. The word is the world is your oyster, right? And and I applied at different locations after that. I had a year and a half. They would tell me you only have a year and a half experience as a CRA. Oh man. I got exactly 2 years, and I threw my resume out there, and I mean, I could not keep track of the pharma companies that were calling me.
Right. Applied knowledge is power. It's not just knowledge, right? It's applied knowledge.
Exactly.
You got to get your foot in the door. You have to leverage your experience. That's applied knowledge.
Exactly. That's exactly what. And I tell you, after that, I was able to go in there. It's like, okay, well, who's going to give me the best offer here? I mean, that's how it was. So really, in this industry, what matters is your experience. You have experience, data manager. How can we transfer it to you? How can we work? You know, how can my experience work for your company? What can I do for you? Learn everything you can about the company also that you're going to go talk to. This is what we were talking about earlier. I can't have someone who comes to interview who has no idea who we are. You didn't do your homework. You didn't prepare. So if you want to get your foot in the door, let me tell you, this is an industry that it's not only about what we're teaching you. People want to see what your personal growth is. How much are you going to put from yourself to grow in this industry? That's how you're going to make it. If you're just there to do one little tiny thing and you don't have much of a drive, trust me, this industry will eat you up. I mean, that's just the way it is.
We got a question. Alan, besides CRA, what can a CRC transfer to after 2 to 3 years of experience?
CTA, feasibility groups, regulatory. I mean, there's just so many things. I mean,
in-house CRA,
Site director.
Site director.
Site director. If you want to open up your own site, I mean, site manager. I mean, there's just so many opportunities out there. Don't just think this is all I can do because this is all I've ever done. I mean, I had an amazing professor at school that told me one time, he said, you know, when you get when I had my associate's degree, he said, your doors have opened this much. He said, you need to look, when you got your bachelor's degree, your doors open this much. If you're sitting there with a master's degree, I mean, your doors are wide open. PhD, your doors are great open. What doors are you going to look into, right? That's up to you. If you think that this is all that I can do, then that's all that you can do. If you feel like I'm just a CRC, I can't do this and I can't do that, then that's all you're going to do. It's like, just apply, just go out there. And even if they reject you, at least, you know, they rejected me because of this. So maybe this is something that I need to work on. This is a skill I need to build up on. So, I mean, it's all a lesson, right? Everything's a lesson.
I think the first thing that you have to do is stop self-rejecting, because you're the first one that closed your own door. So.
Exactly. I'm just a CRC. That's amazing to be a CRC. You know how much you have to know as a CRC? You're amazing if you can make it as a CRC. There's so much work and responsibility when it comes to being a CRC. I can tell you.
Confidence comes from failing as much as it does from winning.
Exactly. And I felt like as much work as I did as a CRA, I felt like I had to know so much more as a CRC. You're taking on so much responsibility and you're dealing with patients. I mean, you're dealing directly with patients.
Coming Instagram.
So
fake it until you make it.
All right. So we got, let's see here. We got people. Let's see. We got a bunch of questions. So hold on. Instagram, I want to see your questions on here too. We're not ignoring you. No, I'm not pinning any questions. I got only 2 hands. Okay. But we're going to go answer some questions. And see, companies definitely look at your qualification and experience, but one major thing they look for is the attitude and how ready the candidates are to take new challenges and how willing and open you are to learn new systems and take on responsibilities in the role. And also, part of attitude is confidence, like everyone was just mentioning right now. So thank you for confirming that. Question from Instagram. What are the things as a CRC I need to know when I want to branch into vendor management? I might have to send this one back to you, Marjorie. Vendor management.
I don't know much about vendors. I don't know about vendor management. I mean,
you got to know the vendors in research. Okay, you got to know the vendors, and they're written in this book. Okay, we try to make it as simple as possible for you guys. Know the vendors. There's like on average like 11 vendors in a study. There's the IRB, there's the EDC, there's the eSource. Usually, there's the labs. There's the IWRS. There's the rating scale. There's like 11, right? 11 vendors on average. Patient recruitment firms. people
Yeah.
like Ivan. So you got to learn who these vendors are. And then when it comes to vendor management, I mean, managing your vendors, are they doing what they said they're going to do on time? Are there issues? You just got to understand a holistic approach to the industry. So the book, I think, this is one of the reasons why we wrote it, the Comprehensive Guide to Clinical Research. Keep the questions coming on Instagram. I want to see hearts.
It's
because
almost kind of what we were talking about, project manager, right? Managing those vendors. Yeah. So I guess that would be about it. You're managing to make sure that the vendors are doing what they have to do for each project. I mean, trust me, there's always an
A big
issue
project.
with somebody. So that's a big project to manage the vendors within each study.
And making clear to your vendors what the goals are from the beginning and measure to them.
Wherever
Exactly.
you're watching, I want to see hearts, likes, whatever that button is, because we need the algorithm, the social media overlords, to show this to more people. Okay, and they interpret your likes and hearts as the green light to send it to other people. So I want to see those thumbs and hearts like going crazy.
I see somebody's that they want to send their resume to us. So you could go to our website, topazclinicalresearch.com, and you can contact us through there. So the name is it. That's our website, Topaz Clinical Research. And our emails are there, and you'll be able to contact us through there, through our website.
That's right. Man, we get some more questions. Enthusiasm and deliver. Vendor management mainly deals with knowing the scope of work and maintaining their relations and a regular meeting with them to address all study needs. Exactly. And before that, you got to know who the vendors are, right? Like if you're going to go interview, you got to know what's IWRS, what's the central lab, what's IRB, how do you manage these vendors? Okay, Monica has a question here from a LinkedIn user. Besides experience, industry should also take advantage of other clinical licensed folks like RNs or PhD educated individuals with some type of research related regulatory experience. So that's not a question. Hold on. That's a statement. Yes, I agree. I agree. I agree, but it's not the ultimate end all be all. Oh, how can you increase the odds of getting new studies as a site? Man, wear purple.
Come on, Dan. You got lots of videos on those.
Well, I learned you got to wear purple.
Yeah, we definitely do.
Your website needs to be purple and gold.
We do. Every investigator meeting, we're dressed in purple, so you will know who we are.
Don't you have to dig a tunnel into research.org or something like that?
Clinicaltrials.gov.
Clinicaltrials.gov.
Yeah, but I think that the
if you buy clinicalresearch.org, like a lot of people do that I learned today, MD Anderson bought that domain, so they get all that accidental traffic to their website. What was that? Yeah.
So the one of the tips that I learned from Dan is that you have to follow up, and drive them crazy until they answer you.
Oh,
the
yeah.
emails, the sponsors.
Yeah.
So I
The
think
Dr. Pepper method.
Yeah, to get more.
I learned from a really he's 80 now, about more than 80, businessman, very successful here in Newport Beach, California. He told me the Dr. Pepper method, when you need something, you gotta be persistent. You start at 9 a.m. and you end at 6 p.m. and every 15 minutes you make a phone call to this person. They will answer before lunch, okay? Unless they're like on vacation or something, and then they're gonna get back to their phone and see all these missed calls from you. That shows persistence. You could also annoy somebody doing that. So use it when you absolutely need to. But if you're trying to get a job, what's the worst they could say? No, right?
Yeah. Yep.
Or new studies as a site. I mean, if they're gonna say no, I'd rather hear them say no, right? Rather than leaving me out, to see, okay, maybe they're gonna take me, maybe they won't. Right now, the market's in your favor. Just like for jobs, there is more studies than there are sites to fill.
Yeah. And also joining networks, right? Because we've joined Latinos in Clinical Research, and we were in part of the Patreon group. We've joined those groups. We do networking. We've just looking for networking opportunities, and also knowing that we're more than happy to share if you're happy to share. I mean, so if the opportunities are there, they should be there for all of us, right? So if we have a study and you're in another part of town or another part of another state, why wouldn't we pass on that information? So it's about networking also, and that gives you the opportunities.
Read that one. I'm with you guys. Somebody says, I am with you guys, but I need opportunity to be in the field. Is it very hard to get in? Okay. So what do you say about that?
To be in the field? To get in the field.
You need opportunity. I'm sorry, I didn't hear.
Somebody says, I'm with you guys, but I need the opportunity to be in the field. It's very hard to get in.
Well, I know that Dan's talked about it in the past where he said, can you volunteer? Can you get in there on a weekend and look at and help out somehow, We've done that. We've had people intern. Actually, our amazing nurse Christy, I mean, she showed up here and she was here at our site. She came to learn, and then eventually we had her, well, why don't you come on in here and look at this, this patient while you're here? That's how she got into the industry. I mean, it's like, what are you going to offer site? Yes, not everybody's going to give you that opportunity. Keep looking. We had someone else that actually ended up getting hired by one of the hospitals straight into the regulatory and oncology regulatory department. She volunteered with us for 3 months. She did social media for us. She was here doing study coordinator work. I mean, I'm all about, if you're showing me enthusiasm, come and work for me, and you're not going to sit here and waste my time, then I'm going to give you that foot in the door. So if you have to volunteer, if you have to say, hey, how can I help out? Can I be part of your health fair? It's just, be creative on how to get it.
How about, hey, Topaz, what if somebody approached you like this, Marjorie, okay? Hey, Topaz, hey, Marjorie, I love what you're doing, love purple. I noticed Topaz doesn't have a TikTok channel, and I will run a TikTok channel for you. And all I want in return is to intern at your site.
Come on in. And how many TikToks are you going to put out a week for us?
Exactly.
And, what exactly are you going to do? I mean, because I get it. You're going to do a TikTok for us, but I don't need just one a month. If you're going to be here, how many are you going to do? And exactly what is it that you're interested in learning?
But the point is, have an editorial calendar with that too, to make sure that the content is relevant. But
even better. Exactly. You want to sound more professional? Take the Ivan route. Hey, Marjorie, does Topaz Clinical Research have an editorial calendar of when you post things on social media?
We don't. We need that. Actually, thanks, Dan, for saying that. So somebody out there who's interested. No, we don't. But I mean, that's definitely something that's going to help our site. That's going to get people to see us. Now, you're interested and you want to come in here and intern. So you're going to give us something for the time that I'm going to take down to teach you, right? Yeah. But then I also don't need to sit here and teach you, because if you're going to come in here and do something for us, that's great. But you only want to know how to take temps, or you only want to know how to do one thing, then you're really only going to get in my way. Yeah. What is it that you need to bring to Topaz? What's your interest in learning about this industry? And we talked about this in Patreon earlier. I have so many people say, I'm interested. I send them a GCP link and they won't even do their modules. So then it's like, you're showing me that
right.
You're not
or
interested. Right?
I'm interested. And then you send them the link and then they say, well, it's not letting me log in or something. Like they're giving you more work
Figure it out. The year 2021, the year of no excuses. This is us, right? So then it's like, also, once you did GCP, I'm excited. Here's 20, and I have like 20 other links that I'll send to you that you can do on your own time. You know what? I've had people within a week send me all the certificates that had to do with it. They didn't have to. That showed me their enthusiasm. Come and work with Topaz and come and do something with Topaz.
Here's another question.
Initiative.
Exactly.
We got the YouTube people going. Here's a question from YouTube. Make sure you like, subscribe, and hit that bell button so you don't miss. I was told if you apply too many times without being interviewed, then that could work against you. That's probably right, but I would counter with, well, what's the alternative? You're not going to apply, and then you're in the same situation.
Exactly.
I'm telling you, I sat there, like I mentioned before, where I had all these interviews, and I mean, trust me, all the recruiters are not sitting next to each other, talking to each other. Like, look at this guy. He applied at our company. He applied at that company. I mean, people are just not taking the time to sit there and say, look at this guy's resume, came by here twice. I mean, or he applied at your company and now he applied at my company. So what?
Tweak and refine your credentials. A lot of people send in resumes that aren't, it's always the same, or it was a few degrees off the mark. Tweak your resume. Maybe that'll get you in.
Hey, look at typos. Look at the, I mean, we look at all of that. Believe it or not, we look at everything that has to do. It's like I'm not a grammar Nazi, but she is. And if I see an error on your CV, you don't have that attention to detail that it takes to be in the industry. That's the way I see it.
Somebody on
Because
Instagram told me, Dan, you need to improve your TikTok content, post more. I absolutely 100% agree with you. I stopped using TikTok because I thought it was going to be banned, and it's not. And I at 100% agree with you. It's very important. I need to do more.
Dan's looking for a TikTok person over there to help him out.
Yeah, seriously, TikTok person. I'll give you GCP links all you want. What's this? Oh, Dan, can you tell me if you are running your CRA Academy virtually? So yeah, both CRA and CRC Academy are virtual. They're both 3 months. It's completely online.
And both of them have the internship. So at the end, you have experience too. Not just the class, but the experience.
And we've been doing virtual internship where we're monitoring oncology remotely. And when the pandemic's over, we're going to do it in person again or remotely, because remotely is working really well, actually. And here's the most important thing. CRA Academy students, CRC Academy students, they're getting hired. They're getting hired. Part of that is because we're good. I want to say all of it, but it's not that's not the case. The case is the industry is very favorable right now to people who know what they're talking about. Somebody says you can cross-post to IG via Reels now, and they promote it more. I need to do that. Becca, hit me up in the DMs. Let me know what I'm not doing right.
Well, this is one thing that I've also noticed where we I guess you're getting asked the same questions over and over. I mean, we started, like I said, I opened up my site in 2016, and I was like, who is out there in the industry that has content online? And I found Dan in 2016. Literally, Dan had, I think it was a 4-hour training, and he sits there and takes the time to teach you how to run a site, how to be a CRC and everything else. And now they actually have an academy. So the material and the content is out there. So if you're asking, what should I do? Where should I go? How can I learn? It's here. It's online. It's free. I mean, so you need to start looking at those things instead of saying, what should I do? Where obviously the CRC Academy, I mean, I remember one time Dan was teaching it online live on Instagram. I have years of experience. I was like one of the few people on there making comments while he was talking about things online. He was doing a CRC training or monitoring. And I was like, you're right. And I mean, and I was making comments and I was thinking, this is gold, people. This is gold and it's free. And this person is offering it to you for free. Then you're asking, where can I get more information? The information is out there. Where do I get GCP training? You know what? There is free links out there. Get GCP.
Let me pin this comment. I know how to pin this comment. Okay, I freed up my other hand. I was a CRA Academy student, and I got hired as a senior site manager within finishing the program.
Awesome.
Look at that. Within a month. Please direct message me. I need to interview you. Okay, when you're comfortable.
Dan sits there and shows you every regulatory document you need to know. You need to know how to Monica, how to count IP. That's like everybody's nightmare. I mean, how to figure it out, how to figure out the days. This is all part of the academy. It's online too, guys. It's on there. It's on YouTube. Dan has posted it because we don't have too many people posting things out there. The information is out there. So if you're interested in knowing these things, and it's great, like, hey, I would love to come to Topaz, whatever. I tell you, I direct everyone. You know what? We follow Dan Sfera. We follow the guru. This is, hey, we tell that to our PIs. This is a link. You need to go on there because there's all kinds of knowledge out there. Dan has put out, his group has put out. You just need to sit there. I mean, like I said, I have experience in the industry, and I'm always online. I'm always watching his whatever he's putting out and posting. So there's always gold being thrown at you. You just need to know where it is and grab it and take it and run with it.
That's right.
Let me get off the soapbox.
If I learned anything today from Marjorie, is have energy, have passion, no matter what state you're in. Okay, you could be a 30-year veteran and have an off day, off week, off month. Okay, but guess what? You're not going to do as well on those days as you are on other days. You're not going to see. Your eyes are not going to be open. You're going to be going through the motions. Who wants to be associated with somebody just going through the motions? I mean, I guess it's not horrible, but you don't like look forward to that.
He's kind.
Yeah. I am asking when the next class is from Dan's Academy. The next CRA Academy is April. The next CRC Academy
It's this month, at the end of this month.
at the end of this month. Okay. Thank you, Spencer, for the book. Thank you. If you have a skill to offer and you're willing to work and learn, a job's definitely waiting for you. Exactly, especially in a year like this. Is the CRC Academy available to somebody in Canada? Yes. We have a lot of students. Probably over the past 5 years since we've done CRA Academy, we've had like over 24 Canadians. Okay.
Wow.
Yes, CRA Academy, there's a fee, and CRC Academy, there's a fee. $5,000 for CRA, $3,000 for CRC. Who else? Let's see. Let's get some comments. What else you guys
About
thinking?
Canada, I had one of the studies I was working with, and they literally, I don't know how Canada was set up, but I know that with the CRAs when they were traveling, they were desperate in one part of Canada to find CRAs because they were only allowed to travel within that area, and they were having such a
Because
hard
being
time.
Canadian, I can speak to that. During COVID, province to province shutdowns. That's correct.
Exactly. And so this pharmaceutical company that I was talking to, one of my monitors was here, and they were like, "We're having such a hard time finding anyone in Canada." I was like, "What?" I mean, they're like, it wasn't just that one company. All the pharmaceutical companies were trying to find help in Canada.
Look in Canada.
So look, guys, there's work in Canada.
There's
No,
work.
there's
There's
a
work
major-
everywhere. Everywhere on the
There's
planet.
work everywhere.
Yeah.
Yeah.
Is there, somebody asked, is there a certain type of study that is in demand right now? Yes, right now, COVID for sure. There's not enough patients for the COVID studies. There's just so many studies. Gastro is very hot right now. Oncology is always. OBGYN has its ups and downs. What else have you been seeing?
CNS.
CNS, central nervous system.
And that's pediatrics. We do a lot of pediatrics. So
Yeah.
so
Just
it's
apply for everything, get a family practice, internal medicine, and then specialize. I started the opposite. I started with a specialist and then we went more broad. We're still trying to do that. What else? We got more comments. You guys, thank you for joining us though. This is really good. Really good session we've had. And
Carla has to leave. Carla has to leave to pick up my granddaughter.
all right,
So-
Carla, thank you very much.
Guys, I'll talk to you
Thank you,
later.
Carla. Thank you, guys.
Thank
And if
you.
there's any more questions, I guess I have to go pick like the best question and send this book out to you. You still have 2 minutes left if you want to throw in a question. Can you please repeat what you said about Canada? I lost internet. All I know is
A lot of
Yes.
job opportunities.
a lot of opportunities, and yes, you can join our academies from Canada.
And a lot of opportunities with pharmaceutical companies because, like Ivan said, you can't travel province to province, right? So
Right.
the pharma that I was talking to, they were having such a hard time finding, just those CRAs that could stay within the province. So
Right.
they were, and it was just not that one company. There's all these pharmaceutical companies needing help in Canada, for the very reason that they can't travel. So the opportunities for CRAs are out there in Canada.
Yeah.
They were desperate for them. Yeah.
What was the best comment? The TikTok one?
And I would like to also mention that there are a lot of opportunities for people that speak Spanish as a clinical research coordinators. So many. Right now here in California, it's incredible the amount of jobs opportunities for people that speak Spanish. If you have that language, awesome, because it's just the opportunities are endless. I mean, and join the Latinos in clinical research.
I was just gonna say, everybody connect with Ivan, connect with Topaz. Make sure you're on the Latinos in clinical research. Any ethnicity, doesn't matter. Okay. And we're gonna have Topaz Clinical Research on in March. Okay, as a guest presenter. So I think that's it with the questions. I don't know. Any question memorable to you guys? To me, it's the TikTok one, but I don't want to be the deciding factor. What questions were good? Or comments? Actually, the one I pinned was, I'm a CRA Academy student and got hired as a senior site manager within a month, but she already has a job. So maybe you don't need to
I think the TikTok one.
EduTech the Plus. So you already have the book. You already have
Yeah,
it.
now that you mentioned that, our students from the previous, I will say the previous two classes, they start applying for jobs even before they finish the class, and a lot of them have got the opportunity. Like even right now, one of my students got hired in the Mount Sinai. So
All right, the TikTok comment wins. Okay, so just send me a DM, and you'll get the book. If you don't have it, or you get to choose from like a couple other ones. All right, thank you guys. I appreciate it, Monica. Thank you very much.
thank
Thank
you.
you.
TheCRCacademy.com, TheCRAacademy.com. Topaz Clinical Research, amazing. Where can people find you?
TopazClinicalResearch.com, and we're in Apopka, Florida. Just send us an email. Let's get in touch, or on LinkedIn. You can find Topaz Clinical Research. We're pretty much everywhere right now. We're going to grow. We're going to do more of what Dan is pushing us to do. Again, I'm always pushing Dan. He's an amazing person. Monica, amazing people. You're going to learn so much from them. And they're going to help us also to grow with all of their knowledge. So TopazClinicalResearch.com in Apopka, Florida. Just contact us.
Thank you.
Contact us. Make it worth our time, guys.
And Marjorie and Ivan are both in the Patreon group, and they're pretty much on every monthly mastermind. So just get in there if you haven't checked it out. Ivan, where can people find you?
You can find me at crankworkscreative.com or crankworks.ca. From consideration to registration is our motto. We've got a diverse group of clients, and we're really trying to better understand the research trial industry. I'd welcome any conversations on the matter.
Thank you, guys. And thank you, Monica. Anything you want to say? Closing remarks, or we're good?
Get registered at the CRC Academy.
That's right. That's right. All right. Thank you, guys. I appreciate it. Thank you, everybody, for watching, liking, subscribing, commenting. Really means a lot. Until next time, catch you later. Stay healthy.